Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. Welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, we will be discussing a strategy the community health centres in the Winnipeg region have used to reduce gaps and delays in access to appropriate primary care services. Last winter, Klinic Community Health set up a temporary same-day care clinic to support their clients who otherwise were unable to access primary care and mental health services. They learned a lot through this process and adapted the service over the course of several months. Klinic opened this same-day care clinic with the support and partnership of several community health centres in the Winnipeg region: Manitoba Federation of Labour's Occupational Health Centre and Sexuality Education Resource Centre, as well as Nine Circles Community Health Centre and Women's Health Clinic, who are joining me today. Today I am speaking with Ayn Wilcox from Klinic Community Health, Mike Payne from Nine Circles Community Health Centre, and Kemlin Nembhard from Women's Health Clinic Community Health Centre. All three of these community health centres provide a wide range of health and social services geared to the diverse needs of individuals, families, and groups in Canada. You can learn more about these CHCs and their specific geographical service area by visiting their websites displaying on the screen now and in the description. How's everyone doing today?
Great.
Wonderful. Thanks so much for having us.
Fabulous.
First off, I would like each of you to tell me a bit more about your community health centers, some of the main aspects of your organization, the communities you serve, the services and programs that you provide. And let's start with you. And could you tell me a bit more about Klinic Community Health?
I sure can. Thanks so much, Hilary, for having us on today. So Klinic Community Health is one of 12 community health centers here in Manitoba. We're represented by Manitoba Association of Community Health Centers, member of CATCH as well. And as the name implies, each of these centers works at the community level to deliver programs and services. We do that rooted in social justice values, in the belief that everyone deserves quality care, support, and respect. For us at Klinic, the kinds of services that we offer are primary care services. We have counseling services, including a wide range of services such as drop-in, short-term family violence, trauma, and sexual assault crisis counseling. We have 24/7 crisis support lines, including the Manitoba Suicide and Prevention line, the Klinic Crisis line, and the Manitoba Farm, Rural, and Northern Support Services line. We run a mobile withdrawal community program. We have different programs like life and balance programming, such as yoga, meditation, and we also have education and training for community groups and professionals, including a suicide prevention series, trauma-informed care, and vicarious trauma workshops.
Wonderful. Mike, can you tell me more about Nine Circles Community Health Center?
Sure. Nine Circles really has two main functions, one provincial and one in the city of Winnipeg, or Treaty 1. Within the province of Manitoba, we are a lead community site in the Manitoba HIV program. And so we work with partners at the hospital level and in primary care partner sites throughout the province, really to make sure that everyone in Manitoba who's living with HIV has access to the same care, treatment, and support, no matter where they live in the province. It's a goal. We've got some work to get there, but that's one of our main functions here, is to support that process. Directly at Nine Circles, folks who live in the city of Winnipeg or the surrounding area who are living with HIV will access primary care, treatment, and support here on site, which means they don't need to go to a specialist in a hospital for their HIV treatment. It just happens all here in the community. And with that, we offer additional health promotion and support programs ranging from outreach workers to help people who need a little more assistance to engage in their primary care, mental health therapists, social workers, and health promotion and wellness programming, really just to help people live well with HIV. Much of that focusing on how people navigate issues of stigma and criminalization and issues that face Manitobans and Canadians living with HIV consistently. Additional to that, we sit within the downtown Point Douglas area with a number of our other community sites, and really are here to deliver primary care supports to structurally disadvantaged folks who live in the downtown Point Douglas area and who need a more supportive primary care model, or for whom more traditional ways of accessing primary care just don't work. So really offering that services to folks who may struggle to connect in other areas because they're people who use drugs, or they're folks who work as sex workers, or they've experienced racism or homophobia or things and other isms in the system that will draw them to a community health model where they get a bit more support.
And Kemlin, can you tell me more about Women's Health Clinic?
Yeah, absolutely. So we've been around. We're a feminist pro-choice community health agency here in Winnipeg. We also do primarily work in Winnipeg, but we also have lots of provincial programs. We've been around for 40 years. We offer a wide variety of services to people of all genders, predominantly focusing on sexual and reproductive health. So we provide, client-centered, non-judgmental, like fully confidential health and wellness services. Some of the programs that we have include, the only community abortion clinic in the province, and that's both surgical and medication abortion. We also have the only community birth center in the province. And it's actually, I think, the first community birth center outside of a hospital across the country. I don't know if there are other ones actually, but I know we were the first. We also have a provincial eating disorder prevention and recovery program, which is for people of all genders who really want to, improve their relationship with their bodies and food. We have things like sexual and reproductive healthcare, so including providing STI testing, birth control, Pap tests, and all that stuff. We also have counseling services for teens and adults, which are free. We also provide other maternal and parental supports. Then we also do advocacy on women's health issues. We do have some primary care, but very small, like specific primary care. And really, our goal is to provide predominantly for women, but also for people, gender non-binary, like to provide care that is non-judgmental, client-centered, feminist, and pro-choice, right? So providing people all the information so they can make the choices for themselves, the best choices for themselves about their health and wellness. So that's generally what we do.
That's wonderful. Ayn, I'll throw it back to you. Can you explain to me how the idea of the same-day care clinic came to be and why you felt it was important to create this last winter?
Sure, I can start, and I know that Mike and Kemlin will probably have some other pieces to add. I think the idea around this really came from the MAC table, so where the 12 community health agencies sit and regularly plan and try to address issues that we see are coming up in our agencies and in our community. And of course, COVID has been profoundly impactful for everybody, but particularly we were seeing the impact that was having for creating more barriers for people trying to access care and supports. Manitoba last October, November, December was a pretty rough place to be. COVID was having a really significant impact. The province went into code red, and that meant that a lot of doors were closing to people. It also meant that I think pretty much every one of our CHCs was being asked to participate in redeployment of our staff to support what was happening in the care homes and in the hospitals, and the need to add more resources there. And so as a group, we had been talking about recognizing the need to be able to support the system, if you will, and providing some staff to support what was happening in hospitals and care homes. But we also really needed to double down on what we were able to do in community, because that first and foremost is what our folks know best, and honestly, it's the way to keep people out of hospital is taking care of people in community, and that was really important for us. And so we spoke about collectively across the 12 agencies, how can we do that? And Nine Circles, Women's Health Clinic, we had two other partners, Manitoba Federation of Labor's Occupational Health Center and Sexuality Education Resource Center. And Clinic were all proximally located in the downtown Point Douglas area, and it made sense for us to take a look at how can we scale up some of the services that we're doing at the same time as scaling down some of the other ones that we needed to be able to support redeployment efforts. And knowing that a lot of the clinics in the area had to close their doors and were exclusively virtual, and we know that just doesn't work well for people. I know at Clinic, and I suspect at some of the other organizations, we had a lot of folks that were coming in the door that were maybe looking for harm reduction supplies or looking for some food, who might also have been symptomatic, right, when we were going through the screening process. And until we stood up the same-day care clinic, we didn't have a good mechanism to be able to actually provide more of that wraparound care, which is really kind of fundamental, I think, to the model and who we're trying to be in this space. And so we spoke about how do we share resources. Clinic had the opportunity, having just in the summer of 2020 moved into this beautiful larger space, to be able to host the clinic here, but it was very much a partnership with the 4 other organizations.
So Kemlin, I'll ask you, from the perspective of Women's Health Clinic, why was it important to get involved and be a part of this same-day care clinic?
Well, quite honestly, I think Ayn said it really, really well. Basically what we were seeing, because we are right downtown, and what we were seeing is just, this, like, people just not having access to care, right? And often people who needed it the most. And when I say care, I also mean that in a really broad way. So everything from people needing to use the bathroom, people needing food, people needing water, people needing shelter, as well as, people that also needed healthcare, like different health and wellness services. And like Ayn was saying, many of the other places where people would go for care were closing their doors, right? And most of us as community health clinics stayed open. When we look at the numbers from the past year, in many cases, we were forced to, let's say, reduce the amount of spots we had actually physically in the space for clients to come in. And yet over the past year, none of our numbers went down. In fact, they went up. They were higher than they were last year, right? Whether it is abortions, births, birth control, like everything across the board, there was more demand and less options for people around, right? And so ultimately, I think that's the reason, right? We saw this need in the community. And I think it's important to also mention that, when you're planning, while it's important to plan as a system in terms of how to deal with something like a pandemic, what often happens is that those that have the most need are not part of that planning, right? And the things that the sort of plans that are made don't include them or aren't accessible to them, right? And so what you find is people that are already marginalized are even more marginalized from the system itself, and being able to actually cope with the situation. And that's exactly what we saw, right? And we saw that people that we serve in our communities were not being served, and were being harmed even more. And so I think ultimately this was a way of being able to pool our resources. So knowing that it's not like we had more resources, but pooling our resources to make sure that we can try and provide as many resources for people who were without in a sort of coordinated way.
And Mike, did you want to speak from the perspective of Nine Circles Community Health Center and why it was important to collaborate in this endeavor as well?
Yeah, to build off my colleagues, I mean, prior to COVID, in Winnipeg and Manitoba, certainly in Winnipeg, we already had an HIV, STBBI series of outbreaks. So we were already a bit overwhelmed with what we were seeing happening in our community. Additionally, Manitoba or Winnipeg is really struggling with a significant homelessness issue, much of it being driven through the realities of crystal meth. And that was before COVID hit. So as Kemlin mentioned, aside from the fact that services around our area were shutting down to virtual, where so many of the folks that we deliver services to probably don't have a computer, they may not have a phone. So they were going to still need in-person engagement. We also had this reality around us of the need was already not being well met before this happened. And the service volume caps that Kemlin refers to would have you try to reduce, sometimes depending at different stages of COVID, up to 75% of the number of people that would be coming through your space. So Nine Circles knew we weren't going to achieve that. We knew that we had a large number of primary care clients who were going to need to continue to come to the site, maybe less frequently if we could swing that, but sometimes not even that could be changed. And we also knew that STBBI testing, harm reduction supply distribution, naloxone support in particular, because we were seeing a lot of overdoses, needed to be something that we just kept open. And because of that, we were not going to be able to reach some of those volume targets that were recommended, and recommended for really good reasons. So we did realize quickly our STBBI testing service was probably vulnerable in that in order to achieve some reduction, that service may need to slow down. And we were worried about that because of what I already described. And so the opportunity to collaborate with Women's and Clinic and others who we know also do amazing work in this area was really a relief, honestly, because it meant we could easily communicate to folks who normally engage us for their sexual health services, that there was a trusted space where even people who work at Nine Circles could be seen there, that would allow us to continue to operate at Nine Circles the way we needed to, in a low threshold way for those folks who really needed us to keep the door open, and then redirect those folks who needed less intensive types of supports, like their routine STI testing as an example, over to a shared space so that they wouldn't lose access, but we would still be able to find a bit of that safety balance in our COVID response. So it was really exciting for that reason. I'll also say from a personal perspective, we've long advocated to our regional and provincial systems that one of the reasons why they really need to continue to support and invest in community health centers is our ability to pivot and move when the needs of the community evolve. And the larger systems have a harder time doing that. But we've not had many opportunities to prove it because those investments haven't always been forthcoming. And this really was an opportunity for us to show them this is what we mean, that we can quickly move and adapt our resources and meet the needs of the community. That's why you have community health centers. That's why they should be invested in. And our initiative is one of those. Our sister agencies at Aboriginal Health and Wellness initiated a testing site for Indigenous folks through a space called Thunderbird House. Our colleagues at Mount Carmel Community Health Center supported an emergency access housing space. So folks who were homeless or housing insecure, who were symptomatic for COVID, had a safe place that we could send them to isolate, which is not something that was in place before. So community health centers really during this COVID period have shown truly what a community health model of care is all about. And we hope and think that that might be really useful for us going forward as well.
I think that that's amazing to see, you know, like the word community really coming together with all of you guys collaborating and being able to come together for the safety of your your groups. I'm curious to hear, because that was a lot of successes. I would love to obviously hear even more successes and some of the other challenges as well that came with trying to, you know, have this successful same-day care clinic. I'll start with you, Kemlin. Just curious what you think some of the challenges and successes were from your perspective.
Well, I mean, okay, so maybe I'll start with the challenges. So some of the challenges, well, for us more is just we actually don't have a really big, like a robust primary care sort of wing, right? We actually have very few doctors, very few nurses. And so like I think being able to support for us, like being able to support it in a really robust way, I think we would have liked to even been able to do more, I think, but like given that, the pressures on our system already. So like I was mentioning, the amount of birth control that because I think we have the only free birth control program in the province, and at least in the city. And like we always give out, $100,000 worth a year or more usually. It went up, right? The amount of like births that we had at the birth center this year also went up, and the demand for abortions also went up. So across the board, where we're looking at, like the demand for our services was significant, like it was higher, right? And then also trying to, dealing with sort of some of the other fallout of the pandemic. So stuff like, our counseling services and our eating disorder services, people were and still are, like in terms of mental health, in really a really awful space, right? And yet we had to redeploy a bunch of that staff. Right. And so our wait times went up. Like I know with our eating disorder, our wait time went up from about a year to 2.5, right? Like significant, and that can have significant like negative impacts on people's health, right? Like in terms of the outcomes for eating disorders are worse than in almost any other sort of mental health issue. And so you need to actually get to them as soon as possible. So there was that challenge, plus the challenge of being able to actually provide support for the same day clinic, right? So there was like these dueling challenges, and I think across the board, all of us were feeling that. And there was, obviously no extra resources, and then also I think working in healthcare, all of our staff, and that was a year ago, and they were exhausted already. Now it's the level of exhaustion and sort of burnout is significant. But then also it just being able to serve people the best that we can, and just feeling pulled from all sorts of different ways, right? I think would probably be the biggest challenge. In terms of some positives, I think like Mike touched on it, right? Just the ability of community health to be able to pivot, and the resilience of like, our sector, right? And also our level of partnership, right? Like that, I think you can't buy that stuff, and you really can't oversell how important that is in terms of the level of partnership and collaboration, and how, what an impact that can make, both for us as an agency, right, in terms of being able to work with our partners. And we always had a good relationship before, but I think this just increased that. But I think also how that impacts our community. To me, those are some of the really big positives that came out of that.
Mike, what about you? What do you think were the bigger successes and challenges that you faced?
Yeah, I think rather than challenge, I do, it's a good opportunity for us to acknowledge we're very honored to work with the kinds of human beings that choose to work in community health, and our staff on the front lines. When so many people I knew in my family and my social network were isolated at home and figuring out how to work from home, which was not easy, we got up, and our teams got up every morning, and they got in the car or they got on the bus with their masks on, and they made their way in to some very confusing and nebulous spaces where we didn't exactly know what we were dealing with, but we knew that the community was needing us more than ever. And we figured that out, sometimes changing where we worked and what we did through the process of that. That was not easy, it was challenging, and so it certainly is something, as we reflect back on, that we could be very proud of, and proud of the teams that we work with on that, for sure. In terms of the success, I think what we grow from here is exciting to me. Already, Nine Circles and Clinic are talking about ongoing collaborative opportunities with our STI testing clinics. We're in close proximity. We're both struggling with volumes and resources. There's got to be ways to work more collaboratively together, and we're actively looking at those. Nine Circles and CIRC are looking now at opportunities. PrEP is on the formulary in Manitoba. That probably is surprising for anyone else in Canada to hear that that's new, but that's new here. And so we're looking at how we leverage what we both have to make sure people are aware of that and provide access. So this way of working, I think, now evolves to become the way that community health centers work in Winnipeg now. And I'm excited about that, because I think that we can expand our reach significantly. Community health centers are always, it seems like we're always at the bottom of the hierarchy when it comes to resource allocation. And Manitoba is in an extended period of austerity that is going to be around probably for a little bit longer yet. And so finding ways to do that together are really the best ways to meet the needs of our community. I think this has driven us and brought some excitement and creativity out in people that was there, but maybe this sparked that flame a little bit so that people are really acting on it now. So I'm excited about that opportunity that comes out of this, as difficult as it was.
And Ayn, what would you say to that? What do you think were the successes and challenges that you experienced?
Well, I don't want to repeat what Kemlin and Mike have both said, but I think it is incredibly important that we acknowledge all of the staff that were involved in all of this. It was an incredibly stressful time for people who were being redeployed, whether they were being redeployed within community, even within clinic, because we had folks who even just, were, I shouldn't say just, but who were doing one role and we asked them to do another role. And we're being redeployed to other organizations, to other completely different settings. And so the anxiety at a time when COVID was completely out of control in our province, and we were still very much in a learning mode, was really high. And yet the heart of the people who do this work shone through, I think. And so for me, that was incredibly inspiring to watch, and to be a part of. I mean, we had staff coming from Nine Circles, from Women's Health Clinic, who were coming with like hardly any notice, any time to kind of absorb that, and they were coming onto a new site to use, a similar system, but we've got different processes in place. We've got different people. They're working in different space. We had a COVID assessment clinic here as well, so we knew that we had folks who were coming in who were, we use green, orange, and red in terms of the risk. We knew that we had people coming in. We had really good pathways, we felt, but for people who hadn't been working in that environment, I think that was pretty anxiety provoking for folks. And they did it, and they did it with such incredible heart. I think for us at Clinic, we also kind of reorganized how we do the work. So we had lots of providers, but we really focused most of the work up front. And I haven't figured out like the right words to describe it, but it's kind of that welcoming center. If somebody comes into our space for whatever it is that they're looking for, we put a lot more resources and thought into that as kind of the first point of entry, because these were folks who, never mind service providers were shut down, but the Tim Hortons down the road was shut down. The coffee shop that they could normally go into and sit for coffee when it was getting really, really cold. All of those places were closed to them. So we really wanted to make sure that we were wrapping around care and helping them with whatever it was that they were looking for. So whether it was the bathroom or harm reduction supplies, or they needed to see a doctor, or they needed access to some crisis services or counseling services, trying to figure out, and it could be services that were offered on site at clinic, or how do we give them, a warm handoff or a bridge to somewhere else if that's what they needed. And so I think that was challenging, because we were doing that. We were pivoting very quickly. And we didn't know how long we were going to be doing this. So the other thing for us is we set this up as a 7-day clinic, 7 days a week. We weren't previously providing 7 days a week service. And so it was a whole new model for us in terms of having like this generalized walk-in clinic where you actually just don't know what people, what it is that they're looking for, or if we're going to be able to support. So we set it up as 7 day a week. We had no idea how long. We said, we think until the end of January, but we just have to see how things play out. We ended up scaling back the hours based on the demand over time, as in the spring things started to open up a little bit, and eventually shut it down in June. But we had no idea what the timeline was going to be, and we just had to roll with that, and that was challenging because we were also still trying to provide all of those other really essential services. But for me, seeing the staff learn from each other, because that was one of the additional benefits, I think, is learning how other sites do things, and just that shared, oh, you do it this way, oh, maybe we should think about doing it, and you could see that on the ground. But I think also, as Mike and Kemlin spoke about, just that partnership that we had between the 5 and then the support of the 12 CHCs here in Manitoba that we could rely on and support collectively was pretty incredible.
That's great. I will ask the last question. I mean, this has been a beautiful snapshot of the response of this question, but what do you think your individual experiences at your respective community health centers say over the past 19 months say about the ability of community health centers to adapt to emerging social and public health issues and the importance of the CHC model? I'll start with Mike, since I think that you've already said it quite well earlier, but if you wanted to reiterate your point, I thought it was great.
Well, I think I'll say certainly it's emboldened us. It's made us feel more confident that what we have said philosophically about community health centers can be true, that we can do this, and our collective teams will embrace it, even with some hesitancy sometimes, that this is something we can mobilize ourselves to move where the community is needed. Not to negate the challenges that Kemlin rightly brought forward, which is there are other services that we deliver that don't happen when we do that, because we are limited in our resources, but it's certainly possible and important for us to be thinking about as new challenges face our collective communities. I also think that we've learned, it's reaffirmed for us, unfortunately, that the larger systems around us do not plan with a health equities lens in the way that we hoped they would be. And we have work now to do to challenge those systems and try and make sure that those systems improve that approach, and that we get to those tables more quickly where that planning is happening. And we've learned as well that I think we can do more to build our relationships downstream from some of those larger health systems, where we were looked to as a resource as community health centers were from drop-in centers and shelters, and the local places, because as they were having to shut down, community health centers were also finding themselves being the community bathroom and the place to warm up and the place to get things that we weren't necessarily designed to be. And so we did a lot of work reaching out to those traditional folks who did that to say, this is what we're hearing from the healthcare system that tells us we can do this safely. They weren't getting that information. And so we could pass that on and grow the network response beyond the healthcare system into a broader social service system that would maybe otherwise not maybe have been quite as quick to feel confident to open up their doors to certain things. And so I think we've learned a lot about our place in the system and how we can be stronger allies and more helpful in ways that we hadn't thought of before. So lots of wonderful things that stress us out in terms of resources, but are motivating in terms of our vision as community health.
What about you, Kemlin?
Yeah, I think Mike touched on a lot of the things but I think one of the things that it's this experience and just the pandemic, like the experience in the pandemic and looking at how CHAs in general have pivoted and responded to the needs in community. I have often thought, to be completely honest, I've often thought that this is the model that we should be providing primary care through for our communities, right? Because often with community health clinics, it's a much more holistic sort of approach to primary care that really, generally speaking, treats people as whole individuals, right? Which then provides much better health outcomes, right? And has such an important impact not only on the individual, but on your general community, because individuals are doing better in their community, right? And I think in many ways, this kind of demonstrated that in lots of ways in terms of how we as a community, so not just individual CHCs, but as a community of CHCs, then use that same model, right, and work together to kind of provide it in a broader sense, right? And I think especially, as one of the things Mike pointed out is, around health equity, even more so, I think, than just the general population, but I think in terms of from a health equity perspective, CHCs really do, because we are connected to community, whatever that community is. So in some cases, it could be a geographic community. In some cases, it could be a population or populations, right? But we are connected to community in a much more organic and a strong way. And I think because of that, it means that we can serve the community much better and the individuals in community much better. And so, yeah, like I think to me, one of the outcomes I would love to see from this, I'm not sure if that's going to happen, is that things like this, which I'm sure there are examples across the country of other things like this throughout the pandemic, will demonstrate for both provincial and federal and even municipal governments that this is a model to invest in, right? That as part of, building a broader social service system itself, right? So you invest in housing, you invest, in, let's say, harm reduction, but you also invest in community health, right? As part of that whole broader system. So, yeah.
And Ayn, what about you?
I don't know that there is anything I can add. I think Mike and Kemlin said it so beautifully. I mean, the value of the work that happens on the ground in community health centers is incredibly essential to the overall health of the community. And I think there absolutely is a need for us to do, I think, a better job of sharing those stories with people. So I think that's one of the reasons we're so pleased to be able to have an opportunity to chat with you today, Hillary, so that we can be advocating for more resources and to be at the table where it makes sense in terms of helping to support, because we need to make sure that that community voice is there.
Wonderful. I want to thank all three of you for taking the time to speak with me today. This was a very wonderful and rich conversation. It's nice to have hearing some of the inspiring stories of what CHCs are doing and what the model is capable of. I will ask all three of you just to quickly shout out your websites or Instagram or Twitter links where they can find more out, and any of our listeners, they can find out more about your community health centers. Mike, if you would like to go first.
Here you can learn more about Nine Circles Community Health Center, and you can find all of our handles, social media, and otherwise through www.ninecircles.ca.
Wonderful. Kemlin?
Yeah, you can find out everything, including all of our social media handles, at our website at www.womenshealthclinic.org. So all one word, no apostrophes.
Awesome. And Ayn?
Thanks. Yep. So same for us. Everything's on our website, and we're Klinic with a K, KLINIC.MB.ca.
Awesome. Thank you guys so much.
Thank you.
Thank
Thank
you.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.